Hi guys, welcome back to my channel. I am so happy you chose to join me today. In today's video, I will be talking about some of the things that you might want to know before you get into nursing and some of the things that are important for you to continue maintaining your license. Because just because you have a license doesn't mean you're going to keep it forever. There are certain things that we have to do to remain safe, efficient, and maintain our licensing board practice. So after working as a bedside nurse for about 12 to 13 years, I feel like I've learned a few things that are important for us in our practice. Of course, nursing is a calling for me. It's something that is a passion. I enjoy it. I think I am where I belong, and I believe so. So what is the best way than to share some of the things that might also be important to you and for your career? So feel free to comment down below some of the lessons that you've learned, some of the things that are key in your practice, depending on where you practice, and things that you've done to continue to remain safe in your nursing practice. So I wrote a few lists of things that I thought were important. This is not all inclusive. There are things we'll be discussing and sharing that will keep us up to date with our practice. So number one is, once you get your nursing license, it's always important to make sure that you're renewing your license. Make sure you're getting the appropriate continuous education to maintain your license. And when you get audited, you have the required amount of hours. Of course, it depends on where you're working. If you work in acute care setting, where I did work, there were a lot of continuous education offered to us, and that kept us up to date on what was required of us. And if you're going back to school and you're taking college classes, all those courses account for your license renewal. So that kind of protected me during that time when I was in grad school and during my bachelor's degree when I had gone back to school working as an associate nurse at the bedside. The second thing is practice guidelines. There are state board governed guidelines that you sign into when you get your license. You should be able to read those guidelines and have a clear understanding what is required of you as a practicing nurse and what can come against you if you go against what is expected of you as a nurse. Also inclusive are the protocols that are set forth by your hospital or institutions. For example, inserting a Foley catheter. There are specific protocols and guidelines that you are required to follow when you're inserting the Foley catheter, when you're removing the Foley catheter, so that, for example, you're inserting a Foley catheter and you go way deep and rupture the bladder, that will be against you because you did not follow the correct technique to handle that practice. So it's very, very important also having two nurses insertion practice, where for us, it's required to have two nurses performing that procedure, one going through the steps and the other one doing the procedure. Of course, watching the progress of the practice when you're performing to prevent for infection control. Number three is medication administration. That is huge. As a nurse, we give medications all the time, and there are rights to medication administration. You have to have the right person, the right patient, of course, the right medication, and what is that medication indicated for. There is a right dose, there is a right time, and there is the right route. For example, you give the wrong patient the wrong medication. Number one, that is huge. You're supposed to know, is this medication meant for this patient? How do you know that? Well, you'll ask the patient, what's their name? There is a banner, a scanner. Fortunate for where I worked as a bedside nurse, there was a bedside barcoding that you would scan the patient and the medication. And the best thing is that our practice always audited how many times you missed that step. So that's one of the protocols the organization sets forth for practicing nurses. Number four is the day-to-day undertakings. For example, you go into work. the first thing you do is scan the environment. What is going on? Are there a lot of call lights? Are there a lot of nurses or nurse practitioners, of course? I'm saying that because I'm one. There is nursing assistants. Are they all busy? Is everybody moving around? Is anybody at the desk to answer those phone calls? So you'll kind of have an idea what kind of a day you'll have based on how things appear in the beginning. Of course, that it doesn't mean that your whole day will be busy, but just kind of having a scan of what is going on around you. With that being said, there are very important things that you can do when you first get into your shift. Well, you have the computer system. For us, it was Epic. You look at the list of the patients that you are required to be taking care of that specific day. What is important for me and what I found to be very helpful for me after working as a bedside for so many years is that you have that process of knowing, is there anything that could go wrong with my patients? And can I find that out soon enough so I can ask questions? For example, looking at the vital signs. Were there any changes recorded on the previous shift? Was the blood pressure elevated? Was there a fever noted by the temperature documentation? Look at the vital signs. Was there anything off? Were the white blood counts elevated? Was the potassium low or the potassium too high? Are there medications that are pending to be administered from the previous shift? And you can look at the eyes and nose. Is there documented multiple stools? And that could indicate, multiple stools, diarrhea, elevated white counts. Something should be checked. Is there a fever? So that could point you to something else happening. Of course, you have to look at the patient. And that's where we can piggyback to the things that had been introduced when I was working, which had been very important in my practice, was bedside shift reporting. I cannot tell you how many times I have floated on a different floor and went to see a patient for the first time without doing a bedside. And you can clearly tell, after having been a nurse for so many years, there was something wrong. There was just something wrong and something needed to be done right away. For example, patient is unresponsive, So that's why a bedside shift report is very important, because you can clearly say hello and identify any concerns at that point. Patients have Foley catheters, they have chest tubes, they have IV fluids. Is the IV arm infiltrated and the arm is swollen? Those are the opportunities that you can act very quickly for a patient without waiting for so long. So I found that out to be very important in our practice for, continuity of care for the patients, and also setting patients and your coworkers up for success. For example, if you're leaving the shift, you tell the patient that, hey, I am leaving. I want you to have a wonderful afternoon or night. My colleague will be taking care of you. They're one of the best nurses that I know here, and they'll take great care of you. I'll give them a report on how your day has been or your night has been, and things that are still needing to be completed, and you're in great hands. That's setting up the patient, because they get anxious. They're like, who is coming next? Am I going to have as good care as I did while you were here? So that's usually a very important thing. Unit updates. Always read your emails when your leaders send you information. When I worked in my bedside practice, I would always be up to date with what is happening. There could be a shared communication about incidences that need to be watched out for. So it kind of cued you into things that need to be up to date, or education that is upcoming, or you're pending a review for your promotion, and you just want to be prepared for things that are happening around your environment. And also, after working for so many years, there's this thing that they never teach you at the bedside, and you acquire it over time. And it's a skill and an instinct called the sixth sense. After working for so many years, you can clearly tell when something is not right with your patient. You can look at a patient, the way they're responding to your questions. You can ask them orientation questions, or you can just look at them and see that they're pale, or look at their report quickly and know that there is something going on. And you clearly can tell that nobody else will understand you, but only you might be able to tell what is going on. The best way to communicate that to a provider is the SOAP note. You put the SOAP note and say, I don't know what to put to this, but I feel like this patient needs to be assessed further by you. Or if you want me to, I can call a rapid response and I can do a workup. A rapid response is when you have critical care nurses come to the unit. They're able to expedite some orders that can be checked immediately. For example, a patient might be complaining of chest pain, and they can order troponin and EKG right away, some lab work, and you can clearly find out if there is anything acutely happening to your patients. And usually you're able to save lives. Don't be afraid to ask questions. Don't be afraid to go to your leaders and ask them questions, or ask for continuous education. If there is a skill that you need to learn more of and become efficient, that's always the best way to promote your practice and be a critical person in your role as a nurse. I believe that nursing is a calling and it's a passion. It's a science and also an art. And with these few pointers, I hope that you will find it useful in your practice. Please feel free to share your comment down below. Is there anything that you have found useful in your practice? If you've worked for many years, what are the things that you've been doing to keep your license and stay safe as a bedside nurse? Of course, feel free to subscribe. Please subscribe. I would love to see more of you engaging. We have reached the end of this video. Please subscribe, like, and share, and I'll see you on my next one. Bye.